Welcome back to the deep dive. Today, we're diving into something that's going to have a pretty big impact on students in California,
Yeah, a big
the
one.
CYBHI fee schedule program.
That's right.
Now, you are particularly interested in how this new program works, right?
Yes,
Especially as it relates to Cohort 4.
exactly.
And to guide us through this, we've got a presentation and some excerpts from the program manual. It might sound a little dry at first glance.
Yeah, it's a lot of dense material, but trust me, there are some fascinating aspects to this program.
I think what makes this so interesting is that California is really trying to change how school-based mental health services are funded,
Yeah,
which could potentially impact millions of students.
absolutely. We're talking about a statewide initiative
Wow.
designed to make these services more accessible to every student in California
Every student,
from ages 0 to 25.
0 to 25. That's a huge age range. So it's not just about kids in school anymore.
No, it covers K-12 and public colleges and universities.
Wow.
We're not just talking about a small number of students either.
Okay.
This program has already reached over 2.7 million students,
Wow.
and Cohort 4 is going to expand that reach even further.
Okay, so let's break down the basics. What exactly INS, the CYBHI fee schedule program?
Well, at its core, it's all about increasing access to mental health services
Okay.
for all California students,
Okay.
regardless of their insurance situation.
That's a really ambitious goal. How are they planning to pull that off?
The key here is the program shifts to a fee-for-service model.
Fee for service.
This means schools and providers will get reimbursed for the services they provide,
Okay.
regardless of the student's insurance.
Okay, so that's a big change from how things have traditionally worked, right?
Yeah. In the past, navigating the world of insurance and reimbursement was a nightmare for schools.
I can imagine.
This program is designed to streamline everything,
Okay.
make it easier for schools to get paid.
So instead of schools having to jump through all these hoops to figure out billing and insurance, this program kind of simplifies things.
Exactly. It lets schools focus on what really matters, helping students.
Right, that makes a lot of sense. But hold on. Does that mean students have to have insurance to benefit from this program?
No, not at all. It's important to remember that this program includes students insured by medical managed care plans, medical fee-for-service, commercial health plans, and even disability insurers.
Wow, so that covers a pretty wide range of situations.
It does, but it's also essential to know that students without these plans can still receive services.
Okay, so how does that work? Where does the funding come from if a student isn't insured?
That's where things can get a little tricky. Schools will need to explore alternative funding sources.
Like what?
Things like the local control funding formula.
Okay, so the program prioritizes students with existing insurance coverage, but it doesn't leave uninsured students behind. It just adds another layer of complexity for schools to figure out.
Right. And this whole idea of streamlining and efficiency is a theme you'll see throughout the program. For instance, they've brought in a third-party administrator, or TPA, to handle the provider network and manage all the claims.
A TPA.
Okay.
And who is that?
They're called Carillon Behavioral Health.
Carillon Behavioral Health.
Yes. So Carillon acts as a kind of intermediary between the schools providing services and the insurance companies paying for them.
You got it. So they help make sure everything runs smoothly.
Okay.
So walk me through this. Imagine a student is receiving mental health services at their school. How does this program actually work in practice?
All right. Step 1, the student receives those services from a designated provider at their school.
Okay, so that could be a counselor, a therapist, a social worker,
Yeah.
anyone qualified to provide those services.
Exactly.
Okay,
Next, the school will submit a claim for that service to Carillon Behavioral Health.
okay.
That's the TPA we just talked about.
So Carolyn receives all these claims from schools across the state.
They do. Then they validate the claim, making sure everything's accurate and complete, and then send it off to the appropriate payer, the insurance company.
So it sounds like Carolyn's doing a lot of the behind-the-scenes work to make sure everything is in order before the insurance company even sees the claim.
Yes, they play a vital role. They act as a buffer between the schools and the insurance companies,
Okay.
handling all the administrative details.
That's really helpful for schools, especially those that might not have a lot of experience with this whole billing and claims process. So what happens after the insurance company receives the claim?
Well, the payer will process the claim and send the payment back to Carillon.
And then Carolyn sends that payment on to the school or the provider who originally delivered the service. So it's like a 5-step process. You have the service, the claim, validation, payment, and then reimbursement.
Exactly. It's a closed loop designed to be as efficient as possible. But remember, we mentioned earlier that LEAs, which are essentially school districts, can actually choose to bypass Carillon and submit claims directly to payers if they want.
I guess some districts might have the resources and expertise to handle all of that in-house.
They might. But for many, having Carillon manage the process is a huge help.
Makes sense. It's all about streamlining.
Exactly. But it's not just a free-for-all. There's oversight to make sure everything runs smoothly.
Okay, so who's keeping an eye on things? Who's making sure everything is by the book?
We have the Department of Healthcare Services,
Okay.
or DHCS.
DHCS.
They play a big role in overseeing the program.
So they're like the big boss making sure everything is running according to plan.
You could say that. And they don't do it alone. DHCS collaborates with the Department of Managed Healthcare, DMHC, and the California Department of Insurance, CDI. Together, they define the services covered, manage the provider network, and set the overall policies and procedures.
So there's a lot of collaboration and coordination happening behind the scenes to make sure this whole thing works.
Yeah.
Now, you've mentioned Cohort 4 a couple of times. What makes it so special? What's the big deal with this new cohort?
Well, the CYBHI fee schedule program was rolled out in phases. You had cohorts 1, 2, and 3, which were kind of the early adopters, and now cohort 4 marks a big expansion of the program. We're talking 261 new LEAs and IHEs.
Wow, that's a huge influx of participants. It seems like this program is really gaining traction.
Yeah.
But with all these new schools and institutions joining, what's the application process like for Cohort 4? Is it super competitive?
Well, the focus for cohort 4 applications is on operational readiness. Basically, DHCS wants to make sure that everyone joining the program is ready to hit the ground running.
So it's less about being perfectly polished and more about showing you're committed to making this work.
You got it. They have a set of standards they want applicants to meet,
Okay.
but there's some flexibility built in.
Okay, so give me an example. What's one of these standards? What are they looking for?
Let's take service delivery infrastructure.
Okay.
This means you need to show you've got the capacity to actually provide those mental health services.
Yeah.
Think qualified providers, appropriate facilities, and systems in place to manage the program.
So it's not just about saying, hey, we want to join, give us the money. You need to have a solid plan in place.
Exactly. And there are other standards, too, like how you'll handle data collection, billing, staffing. They want to see that you can manage the administrative side of things effectively, comply with all the regulations.
Makes sense. They're dealing with sensitive information, taxpayer dollars. They need to be thorough. But what if a school doesn't have every single thing in place yet? Does that mean they're automatically out of the running?
Not at all. The application actually allows for different levels of readiness. You can mark yourself as ready, in progress, or even not started for certain standards.
So there's room for growth, improvement. You don't have to be perfect from day one.
Exactly. It's about showing a willingness to work towards those standards. DHCS recognizes that not everyone's going to be at the same level, and they built that flexibility into the process.
I think that's really encouraging for schools that might be hesitant to apply, because they feel like they're not quite there yet.
It is.
Okay, so let's talk timelines. When did the application process for Cohort 4 begin? And what are the key dates going forward?
The application was released on December 1st, and the deadline to submit is January 31st, 2025. Then they'll announce the selected participants on February 14th.
Valentine's Day. Maybe they'll send chocolates with the acceptance letters.
Then there's a Cohort 4 kickoff event on March 6th, followed by the official onboarding process, which begins on March 20th.
So it's a fairly tight timeline, but it sounds like they've laid out a clear roadmap to get everyone up to speed.
They have, and they're not leaving people hanging. There are resources available to help applicants navigate the whole process.
Okay, good. What kind of resources?
They've got a really comprehensive guidance document that covers all the details. You can also find an introductory video online that gives you a good overview of the program. And if you're wondering about the specifics of like what services are covered and how much you'll get reimbursed for them, there's a scope of services document that lays it all out.
Sounds like a good starting point for anyone who wants to learn more.
Definitely. And then there's one more document that's really crucial.
Okay.
The Provider Participation Agreement, or PPA.
PPA.
This is the formal agreement between the LEAs, or IHEs, and DHCS.
Okay.
It basically outlines the rules of the road.
It's like the contract.
Yeah, it spells out everyone's roles and responsibilities for participating in the program.
Got it. Okay.
Now, here's where it gets a little nuanced. The PPA requirements actually vary depending on what type of participant you are.
Okay, I'm intrigued. Break that down for me. What are the different types of participants?
So you have three main categories: lead LEA, member LEA, and independent LEA.
Okay, what's the difference between a lead and a member?
Think of a lead LEA or IHE as the captain of the team. They can form a consortium with other LEAs or IHEs, who then become members under their umbrella.
So it's kind of like a team effort, with the lead entity taking charge of the administrative tasks for the whole group.
Exactly. They handle a lot of the heavy lifting, like submitting claims and data on behalf of all the members in their consortium.
Okay, that makes sense. It would be a lot for each individual member to handle all of that on their own.
Right.
And what about those independent entities?
Well, they're going it alone. They participate in the program on their own without joining a consortium.
So they handle all the administrative tasks themselves.
They do.
Does that mean they have a totally different PPA?
Their agreement with DHCS is slightly different to reflect that they are independent.
Interesting. So the program offers flexibility to cater to different organizational structures, different levels of involvement.
Yep, that's a great point. And within that PPA, there are specific requirements for each type. For instance, lead LEAs or IHEs need to submit a billing consortium addendum. This is essentially a list of all the member entities they're representing.
So it's like a roster, making sure everyone's accounted for.
Exactly. And on the flip side, member LEAs or IHEs need to submit a PPA attestation letter to their lead entity.
Okay.
This letter confirms that they're authorizing the lead entity to act on their behalf to handle all matters related to the CYBHI fee schedule program.
So it's all about establishing clear lines of communication authority.
Yeah.
Makes sense that they would want to make sure everything is organized and above board. Is there anything else about the PPA that's particularly noteworthy?
Yes, data privacy.
Okay.
It's a big focus, as it should be. Both lead and member entities need to show they're committed to protecting student data and complying with all the relevant privacy regulations.
Of course, that's crucial, especially when we're talking about sensitive information like mental health records.
Absolutely. We're talking about CYBHI, which governs health information, and FERPA, which governs education records.
Now, those two often seem to overlap.
Right.
How do they specifically apply to this program?
Well, CYBHI and FERPA don't usually apply to the same service at the same time.
Okay, so it's not like they're double dipping on regulations.
Right. Think of it this way. FERPA generally applies to student education records or treatment records kept by the school or IHE.
So that's the school's domain.
Exactly. Whereas CYBHI comes into play when claims are processed by healthcare clearinghouses and participating health plans.
So that's where Carillon and the insurance companies come in.
Precisely. It's all about understanding where those lines are drawn.
And of course, consent is key in all of this. Parents and students need to be in the loop.
Absolutely. The CYBHI fee schedule program doesn't replace any existing consent requirements.
Okay.
So, for example, if a student's parent or guardian hasn't consented to releasing their insurance information for billing, the school has to find other ways to fund those services.
So even though this program aims to simplify billing, it still respects those fundamental privacy rights.
You got it. And the manual really stresses that all medical records under CYBHI are confidential and can't be released without written consent.
Okay, so they're taking data privacy very seriously. Now, earlier we talked about Carillon's role as the third-party administrator. What exactly does that entail? What does the manual say about their responsibilities?
The manual provides a really detailed breakdown of their role. We already touched on some of their key functions,
Right.
like managing the provider network, receiving and validating claims, submitting claims to payers, collecting payments, and sending reimbursements back to schools.
Right, so they're basically the operational backbone of this whole program. They keep everything running smoothly.
They do, but their role goes beyond just processing paperwork. They're also the point of contact for general inquiries about the program.
So if a school or provider has a question, they can reach out to Carillon directly.
Exactly. And they also handle complaints and grievances
Okay.
from students and parents.
That's helpful.
Yeah.
It provides a central point of contact for any issues that might come up. What about appeals from providers? Does Carillon handle those too?
They do. They play a key role in managing that appeals process as well.
Okay, so they really are a one-stop shop for everything CYBHI.
Right.
Now let's shift gears a bit and talk about the obligations of the schools and institutions participating in this program. What does the manual say about that?
Well, some of the obligations are pretty straightforward. For example, they need to keep the TPA updated on their list of designated providers and practitioners, as well as a list of students' insurance coverage.
So Carillon has all the information they need to process claims accurately and efficiently.
Right. And of course, schools are responsible for submitting claims for the services provided under the program. Remember, they can choose to submit those claims directly to the insurance companies, but using the TPA often streamlines the process.
It's all about making things as easy as possible.
Exactly.
Yeah.
Now, it's important to remember that it's not just the schools and providers who have responsibilities here. The payers, the insurance companies, including medical and managed care plans, medical fee-for-service, commercial health plans, and disability insurers also have obligations under this program.
So it's a two-way street. The insurance companies can't just sit back and collect premiums without holding up their end of the bargain.
Precisely. The payers need to receive and process the CYBHI fee schedule program claims sent by the TPA and then send the payments for those claims back to the TPA.
So they're essentially required to participate in this program and honor those claims.
You got it. They're a really important part of making this whole system work. Now, there are a couple of important caveats here when it comes to the payers, specifically the medical managed care plans, or MCPs.
Okay, I'm all ears. What are the caveats?
Well, first, MCPs can't use the CYBHI fee schedule program to meet their network adequacy requirements.
Okay, break that down for me. What does network adequacy even mean in this context?
Essentially, it means that health plans have to have enough providers in their network to ensure that their members have access to the care they need.
So they can't just say, hey, we've got all these school-based providers in our network thanks to CYBHI, so we're good to go.
Right.
They have to actually maintain a robust network beyond that.
Exactly. The CYBHI program is designed to supplement their existing networks, not be a shortcut to meeting those requirements.
Okay, that makes sense. It's about expanding access to care, not creating loopholes.
Right.
And you said there was another caveat.
Yes. The second one is about contract negotiations. MCPs can't use the CYBHI fee schedule program as leverage to negotiate adjustments to their contracts with providers for services in non-school settings.
So they can't say, well, you're getting paid this much for school-based services through CYBHI, so we're going to lower your reimbursement rates for services provided in your private practice.
You got it. The CYBHI rates are specifically for school-based services.
Okay.
And they're not meant to impact reimbursement rates in other settings.
Okay, that's an important distinction. So we've talked about the responsibilities of the schools, the providers, and the payers. Let's get into the nitty-gritty of billing. What does the manual say about that whole process?
The manual goes into a lot of detail.
Okay.
It covers things like who's responsible for submitting claims, who receives reimbursements.
So is there a designated biller? Is it always the school?
It can be the LEA, IHE, or even the designated provider.
Okay.
They have some flexibility there. However, if the student is covered by medical fee-for-service, then the LEA or IHE has to be the one to submit the claim and receive the reimbursement.
Interesting. So there's a specific rule for those particular students, but in most cases, there's some flexibility.
That's right. And whoever submits the claim is the one who gets paid.
Okay, that's easy.
Keeps things straightforward.
I like it. Now, insurance companies love to set limits. Are there any frequency or service limitations under the CYBHI program?
There are. But the good news is they're not reinventing the wheel here. The manual clarifies that the limitations will follow the existing guidance from the National School Mental Health Manual.
So they're deferring to an established set of guidelines rather than creating their own arbitrary limits.
You got it. They're aligning with best practices in the field.
Okay, I appreciate that. Now, let's talk money. How does reimbursement work under this program?
When it comes to reimbursement rates, the manual is very clear. Managed care plans and insurers are required to reimburse CYBHI fee schedule program services at the greater of two rates.
So there are two possible rates, and they have to choose the higher one.
Exactly. The first option is the rate that the managed care plan has already contracted with the LEA, IHE, or provider.
So if they already have an agreement in place, that rate might apply.
Right. But the second option is the fee-for-service rate listed on the CYBHI fee schedule program, which is published by DHCS.
So DHCS sets a baseline rate, and the payer has to pay at least that much, even if their contracted rate is lower.
You've got it. It's about ensuring that providers are fairly compensated.
Now, I remember you mentioned earlier that schools and providers aren't required to have direct contracts with managed care plans to receive reimbursement under this program. Does that still apply here?
It does. The CYBHI program provides that safety net,
Okay.
guaranteeing reimbursement even if there's no pre-existing contract.
That's huge for providers who might not have the time or resources to negotiate contracts with every single insurance company out there.
Absolutely. It really simplifies things. However, the manual also makes it clear that the program doesn't override existing contracts.
So if a school does have a contract with an insurance company, the terms of that contract still apply.
Exactly. It's not meant to interfere with those existing agreements. And it also doesn't prevent LEAs, IHEs, or providers from establishing new contracts with managed care plans if they want to.
So they have the flexibility to negotiate contracts, but they're not obligated to.
You got it. It's about options, giving them more control over how they manage their billing.
Now, let's talk about payment timelines. We all know how frustrating it can be to wait forever for insurance companies to process claims. What are the expectations under this program?
The manual states that managed care plans are expected to review and send payment, within timely payment standards.
Okay, but what does that mean in real-world terms? Are we talking days, weeks, or months?
You'll find the specifics in the appendix of the manual,
Okay,
but the general idea is that payments should be processed promptly and efficiently.
good to know. Now let's talk about a phrase that often sends shivers down the spines of healthcare providers: prior authorization.
Oh yeah, prior authorization.
Yeah.
It can be a real headache. But good news, the manual specifically states that prior authorization is not required for services under the CYBHI fee schedule program.
That's a huge relief. So providers don't have to jump through all those hoops and wait for approval before they can deliver those services. It just makes things so much simpler and faster for everyone.
It does. The provider who's delivering the service is the one who determines if it's medically necessary.
So it puts the decision-making power back in the hands of the professionals who are actually working directly with the students.
Exactly. And finally, let's talk about cost sharing. This is another area where insurance companies often try to shift costs onto patients.
Right, copays, deductibles, all that fun stuff.
Yep, all those extra expenses that can really add up. But with the CYBHI fee schedule program, you can breathe a sigh of relief.
Okay.
The manual clearly states that services provided under the program are not subject to any cost sharing.
So no out-of-pocket expenses for students or their families.
Right.
That's amazing. It sounds like they've really thought of everything to make these services as accessible as possible.
They have. They've tried to eliminate as many of those financial barriers as possible. Now, you might have noticed another program mentioned in the manual, the Local Educational Agency Billing Options Program, or LEA-BOP.
Yes, I was curious about that. It sounds kind of similar to the CYBHI fee schedule program. What's the difference?
The main difference is that LEA-BOP covers both physical and mental health services,
Right.
but only for services that are required by a student's individualized education plan, or IEP, or individualized family service plan, IFSP.
So if a student has an IEP or IFSP that specifies they need certain health or mental health services, the school would bill those through LEA-BOP.
Exactly. But if the student doesn't have an IEP or IFSP, or they need services that go beyond what's outlined in those plans, then the school would bill through the CYBHI fee schedule program.
Okay, so they kind of have different use cases.
Yeah.
But the manual specifically states that all behavioral health services that are covered under LEA-BOP are also eligible for reimbursement under the CYBHI fee schedule program. Isn't that a bit redundant?
It might seem that way at first glance,
Yeah.
but there's a good reason for it.
Okay.
If a student's IEP or IFSP requires a specific behavioral health service, the school can actually choose which program to bill through. But if that same student needs additional behavioral health services that aren't part of their IEP or IFSP, those would be billed through CYBHI.
So it's about giving schools that flexibility to choose the best billing pathway based on the individual student's needs and the services that are being provided.
You've got it. And the manual provides some guidance on how to navigate this, especially when it comes to the random moment in time survey.
Okay, I have to admit I have no idea what that is. What's the deal with this survey?
The random moment in time survey is used to track the time school staff spend providing health services to students. This data is then used to calculate LEA-BOP payments.
Okay, so it's important to make sure that the time spent on CYBHI fee schedule program services isn't accidentally included in that survey.
Right.
Otherwise, it could mess up the LEA DOP payments.
Exactly. That's why the manual advises LEAs and IHEs to be very careful when they're responding to that survey.
Right. They don't want to create any confusion or double dipping.
Precisely. Now, one last thing to keep in mind. LEAs and IHEs can't bill for non-IEP FSP school-based behavioral health services under the CYBHI fee schedule program until Cohort 4 participants have completed onboarding and submitted all the required documentation to DHVS and Carolyn Behavioral Health.
Okay, so there's a waiting period for Cohort 4 participants.
Yeah.
They need to get everything squared away before they can start billing under the program.
Exactly. It's all about ensuring a smooth rollout
Okay.
and preventing any hiccups in the reimbursement process.
Well, we've really gone deep into the weeds here. It's clear this program is incredibly complex, but also has the potential to be incredibly beneficial. What are your overall thoughts? What stands out to you?
You know, what's really fascinating here is how California is stepping up to the plate when it comes to addressing the mental health needs of students.
Yeah.
You know, they're taking a really proactive approach,
Yeah.
recognizing that this is a critical issue.
Yeah.
It deserves serious attention.
And by creating this comprehensive funding mechanism, they're removing a lot of the barriers that schools and providers have faced in the past
Absolutely.
when trying to provide these services.
It's a bold step,
It is.
and it has the potential to make a real difference.
But of course, with any large-scale program, there are bound to be some challenges along the way. What are some potential hurdles they might face as they implement this?
It does, but you know, with any big program like this, it's really important to think about the potential downsides too.
Right. What could go wrong?
One concern with this fee-for-service model is that it could unintentionally incentivize overdiagnosis or even unnecessary treatment.
Oh, interesting. Could you say more about that?
Sure.
I see how, focusing on billable hours, in theory, could kind of shift the focus away from what's truly best for the student.
Exactly. If schools and providers feel pressure to, generate revenue through these billable services, they might be more likely to diagnose students with conditions that don't really warrant treatment or even provide more intensive services than what's really necessary.
Right. It's a delicate balance.
It is.
And it really highlights the need for, strong oversight and ethical guidelines
Absolutely.
to make sure that this program is being implemented responsibly.
There need to be clear standards
Yes.
for diagnosis and treatment,
Right.
as well as mechanisms to monitor billing practices.
Right. So we don't have any abuse of this system.
Exactly.
And this brings us back to the importance of having those checks and balances in place, right?
Yeah,
Having DHCS, DMHC, CDI involved
for sure.
helps ensure that accountability and transparency are there.
Absolutely. And it's not just about government agencies keeping an eye on things. Parents, educators, mental health advocates, everyone needs to be involved.
Right. Watching how this program unfolds
Exactly.
and making sure it's serving students ethically and effectively.
Speaking of potential downsides, some critics have expressed concerns about, tying these school mental health services so closely to insurance.
Yeah.
They're worried it'll create unnecessary administrative burdens
Yeah.
for schools
Yeah.
and raise privacy concerns.
What do you think about that?
Those are valid concerns. I mean, bringing insurance into the equation definitely adds a layer of complexity.
Yeah.
Schools are going to have to navigate all the ins and outs of billing, coding, claims processing,
That's a lot.
which can be time-consuming
Yes.
and may even require specialized expertise.
And we talked about how the program tries to address that by offering support and resources through Carelon.
Right.
But it's still an added responsibility for schools to manage.
It is. And then there's the whole issue of privacy. Sharing student health information with insurance companies raises legitimate concerns about confidentiality,
Yeah.
how that data might be used.
It's a sensitive topic, and I know the program emphasizes data privacy and compliance with IPEA and FERPA.
Yeah, that's good.
Those regulations are designed to protect that kind of sensitive student information.
Yeah, but it's still something we need to watch closely. There need to be strong safeguards
Yes.
to make sure student data is handled responsibly.
Transparency and accountability are so important here.
Very much so.
Well, we've covered a lot of ground in this deep dive. We explored how the program works, talked about its potential benefits and drawbacks, and even delved into some of the ethical considerations. So as we wrap up, I want to bring it back to you, our listener. We've given you this really thorough overview of the program.
A lot to digest.
Now, we want you to think about how this might play out in your own local school district. What opportunities and challenges do you see this program presenting? What questions would you have? What concerns would you raise? How might this program impact the students you work with or the children in your community? We encourage you to take this information, explore the resources we've mentioned, and engage in conversations. Because at the end of the day, supporting the well-being of our students is a collective responsibility, and programs like this offer a real opportunity to make a lasting difference. Thanks for joining us on The Deep Dive.